We are at the final countdown here before we launch this program today. My name is Steve Gurney, and I am the publisher of Positive Aging Sourcebook, and we're excited to once again be a moderator and the voice from behind the curtain for the Care Patrol series, the education series. Before we kick things off, just a few little housekeeping items. First is, feel free to use chat to communicate with the other attendees. We've got over 175 people signed up for today, so it should be a pretty good networking opportunity, whether you're a healthcare provider or a consumer looking for you or your loved ones. Communicating with the other attendees would be great. Now, okay, let me just mute that there. And so then the important thing is that if you're using chat to make sure to use the drop-down menus that says all panelists and attendees. Second, we really want to make this an interactive program. Interesting, we've already received emails with questions from the audience. So Maria has those already in the queue for her program, but we want you to ask questions. We want to hear comments. You can do that one of two ways. Type them in right when they come to you during the program. Use that little icon down there, the Q&A button, or when we open it up for questions and answers, you can verbally ask a question. And lastly, you can toggle between speaker view and gallery view in the upper right-hand corner of your screen. So I want all of you guys to hang tight for the program today, because we have a door prize that we're going to be giving out, and we're going to be spinning the famous Wheel of Names. So we've already preloaded everybody's name into the Wheel of Names here. 175 of you signed up today. So hang till the end, and we will be giving away that door prize. So with that, before we kick off our program, I want to bring on the Care Patrol team. We've already got Paula Sautier here, who's going to tell us a little bit about what Care Patrol does and what it is. Paula, and while Paula's doing that, I want to welcome the rest of the Care Patrol team onto the screen.
So thank you, Steve. Hi, I'm Paula Sautier. I'm the owner of Care Patrol Baltimore. I cover most of Baltimore County, Baltimore City, and Harford County. Care Patrol helps seniors find safe living options at no charge to you. We're typically helping people find assisted living and memory care. We are local and hands-on. Our process is that we understand our clients' clinical needs today and the future. We know what they want to do, where they want to live, and their financial capabilities. And a client about a year ago called me a matchmaker. And I think Care Patrol is a matchmaker. We match the safest community to our clients' needs. We're able to be successful at that, since we understand that the community's clinical capabilities, their staffing ratio, what amenities they have, their pricing, as well as we do check quality issues by reviewing the state surveys. Since we place so many people, we have real life experiences understanding the care capabilities for our clients. Even in the pandemic, we've been able to help people with virtual tours. And honestly, over the last month, I've been able to go on some in-person tours, which is great. We assist the senior and their families through the whole process until they have been placed. I'm really lucky to be part of a Care Patrol team of 7 franchises that covers Maryland, DC, and parts of Virginia. We have placed over 3,000 clients in close to 1,000 communities. I'm really excited to hear from Maria about Medicaid. I think all of us on our call get asked about Medicaid, if not daily, at least weekly. So thanks, Steve.
Thanks, Paula. And then we're going to real quickly go through the little Brady Bunch square here so that you all can get to know your Care Patrol team members and what regions they serve. And I did cut and paste their names and contact into chat. But right under Paula, at least on my screen, is Charles.
Good afternoon, everybody. Charles Picard. I work in Prince George's County and in Charles County for Care Patrol. Welcome, everybody.
Great. And under Charles, I've got Jessica.
Good afternoon, everybody. My name is Jessica Pinkert. I work under Bonnie Elliott in Care Patrol Central Maryland and Loudoun, Virginia. I work for her Carroll County branch.
Great. And then let's see, moving over to Cindy Evans.
Cindy R. Evans. I have southwest and southeast part of Baltimore County and Anne Arundel County. Thank you and welcome.
Great. And then I'm going to skip that so everybody can see this is a preview of our speaker, Maria Lopez. We're going to jump over her and meet her in a moment. Let's do Amy Fager.
She's muted. Oh.
Hi, everyone. I'm Amy Fager, and I cover, in Delaware, I cover Sussex and Kent County, and then in Maryland, I do the Maryland Eastern Shore.
Great. And then at the top of my screen, I've got Robin Edwards.
Good morning, everyone, or good afternoon. I'm Robin Edwards with Care Patrol of Northern Virginia. Welcome.
Great. And then under Robin, we've got Star Sowers.
Hi, everybody. I'm Star Sowers. I work under Bonnie Danker for Howard County and Montgomery County.
Great. And then last on the screen, but not least, is Bonnie Danker.
Good afternoon. So nice to be with all of you. I am Care Patrol in Howard, Montgomery, and we also go into the district. So we look forward to working with you and helping you and brainstorming with you with care and housing options.
Okay, great. Well, I think I got everybody on the screen. If I missed anybody, we can definitely throw their contact information into the into chat. And now what we'd like to recognize is the sponsor of today's event, which is Tribute at One Loudoun, and we have Cheyenne. Cheyenne?
Hi, everyone. We are Tribute at One Loudoun. We're in a assisted living connections and memory care community. 95% of everybody here, including the employees, are vaccinated with the second COVID shot. Please come see us and welcome.
All right. Well, thank you, Cheyenne, and make sure you put your contact info into the screen, into the chat there. I know I'm jumbling my words here. And so that was really quick and effective. So now we can jump right into the topic and meet our presenter today, which is Maria Lopez, who is the VP of Marketing Admissions for Access Healthcare Group. Maria joined the senior leadership team of Access just a few months after Access Group was established in 2019. Welcome, Maria, and tell us a little bit about yourself. You're an experienced healthcare professional, but out of curiosity, Access started in 2019, pretty new company, but you guys have quite a few centers in your portfolio.
Yes. Thank you for having me. It's really a pleasure to collaborate with all of you guys and sharing a little bit of Medicare and Medicaid today. As you mentioned, Access is new in Maryland. They're part of a bigger group that owns over 30 nursing homes through different states. They're well established in New York, New Jersey, New Hampshire, Florida, North Carolina. And at the end of 2019, they came to Maryland. For those that are familiar with the previous Aurora portfolio, those are the facilities that Access acquired. We own currently 7 nursing homes through the state of Maryland, 2 on the Eastern Shore, which is Caroline in Denton, Menokin, and towards the sides of Prince Anne. In Montgomery County, we have Oak Manor. A lot of people still refer to this facility as the old nursing home for Holy Cross. And then we have in Carroll County, we have 2 facilities, Birch Manor in Sykesville and Longview and Manchester. Towards the other Western Maryland side, we have Mountain City, which was before the Western Maryland Nursing Home. So we acquired that one actually last 2020 March, which was in the midst of the pandemic.
Great,
so it's an exciting time. A little bit about myself, like you hear, I've been with Access when they started reaching out, and I was excited to hear what was the plan that they have for these facilities in Maryland. The portfolio looked really interesting to me, and I've been in healthcare for over 12 years now. I'm very excited. I love healthcare. It's one of those industries that is constantly changing, innovating, and it's, you know, has its ups and downs. Like we say, right now with the pandemic, we had seen quite sadness, but excited and happy to see how we all have come together, you know, and this is actually a perfect example of how we help each other, you know, and inform each other. You know, I hear over and over conversations on how we can continue supporting from one organization to another one. And I see that from hospital to hospital, from nursing homes, so many collaborations that have come through this. So that's a silver lining, definitely is.
Great. Well, thank you so much. We're really excited to hear what you have to say. I think you've got a PowerPoint that you're going to share. I want to remind everybody, we're recording this, so you don't necessarily have to take notes. You can just listen to the recording afterwards. But I want to remind everybody that to feel free to type in your questions as they come to you. And Maria, if a question comes in that's sort of relevant to what you're talking about and you pause, I may jump in and share that question with you to elaborate on it a little bit more. But I'm going to drop off the screen here, and let's take it away.
Thank you. Thank you. Let's get started. As the topic, you know, we want to sort out some myths from the fact of what Medicare and Medicaid has. Feel free to ask the questions as I go through. And I also have received some questions that I will address to the end, but, you know, whatever it works for you, ask in the middle or at the end. Myths of Medicare, let's get started. So these are some of the facts that, or questions that I get asked on the day-to-day. Is Medicare and Medicaid free healthcare for everyone? Does that apply? Because there is that, you know, family member that knows that their kid has Medicare, so that are they entitled to that? Unfortunately, no. You know, it's not free healthcare. There is a specific requirements that people has to meet in order to receive those benefits. Are the costs the same for everyone? That's also another no. Unfortunately, Medicare and Medicaid have regulations based on what you receive as an income. So, and as you know, also Medicare is through the Social Security FICA. So we get a percentage being taxed, taken away on our paycheck. So that's a percentage based on what you make. So through your working life, you know, you're paid on a percentage based on what you make. So that's why it is not the same for everybody. Does Medicare and Medicaid covers everything, including long-term care? Medicaid actually has a section of long-term care Medicaid that does cover. Unfortunately, Medicare doesn't. And this comes actually questions from hospital case managers or social workers. They will say, well, but if the patient goes with you, he goes with Medicare and Medicaid for long-term care. Sometimes that doesn't work that way. So I will be covering more for the slices. I can enroll whenever I want for Medicare or Medicaid. Just like the previous question, it doesn't apply the same for Medicare as for Medicaid. We will discuss further for Medicaid. For Medicaid, because Medicaid has different parts with it, you know, we have what is the community, long-term care, Medicaid waiver programs. So depends on the financial situation and the clinical eligibility. You could apply whenever is needed. Not the same case for Medicare, unfortunately. Am I entitled to Medicare and Medicaid because of my poor health condition or financial situation? That applies to Medicaid, not to Medicare, unfortunately. So let's just, with the first differentiation of what's Medicare versus Medicaid. They are not the same. Medicare is actually a federal funded it's also a national health insurance, began back on 1966, and is managed under the Social Security Administration, now currently through the CMS, which is the Center for Medicare and Medicaid Services. Medicaid is also known as a medical assistant, and this one is federal and state program funded. It's usually the last resource for people that has a low income or limited income and resources. The state has specific regulations. I think it's important to mention too that Medicaid varies from state to state. So for people that move into the state of Maryland, or that they are within the neighbors states, they come in for Virginia, Delaware, PA, sometimes they will see that there is a slightly different requirements, not only on the financial or the income that you're making, but also in terms of what programs that the state has for that specific state. Medicaid managed through the state. So Medicare meds, let's get to the most common ones, and to this also will address some of the initial questions. What are the, what makes me eligible to get Medicare? Is Medicare available for anyone? And that needs help with medical expenses. If this is just the low income person that needs insurance, can I apply today for Medicare? Unfortunately, no. Like mentioned it, you know, Medicare, it's through, you continually pay through it for your work life. It is deducted on your paycheck. And when you turn 65, then you are eligible to start receiving your Medicare benefits. There are some exceptions as people with disability that had maximized benefits under Medicaid, that then they will have Medicare granted to what before they turn 65. That also apply for younger people with disability, in this case, even kids. And then later, the last one is ESRD, end-stage renal disease. This one is usually something that I get asked a lot. Someone that start having kidney issues at the hospital, can we get applied right away for Medicare? Unfortunately, no. So there is actually a waiting period after the person is being diagnosed as ESRD at the hospital that goes from 27 to 33 months for them to be given the Medicare benefits. So you will get it if you are ESRD, however, only after a certain period of time of applying. Myth number 2, Medicare covers all your medical expenses and is it free? As mentioned before, it's not. Medicare has different parts, and A and B is not a free services. Even after you contribute for all your work life and you are 65 and retire, and now you are eligible to have your Medicare card A and B, there is still a deductible of co-insurance that you have to pay. The best example I can give you is with the hospital as well with the skilled nursing facility. Once you have Medicare, you're eligible for Medicare, you also will have to meet a specific requirement to use the specific services. In the case of the skilled nursing facility, you will have to have a skill need in order to come to the facility. Then you're eligible for 100 days of episode of Medicare coverage. And important to make sure that out of those 100 days, only the first 20 days are fully covered. Then on day 21 to day 100, which are 80 days, then there is a 20% of co-insurance. The good thing is that if you're also eligible for Medicaid, Medicaid could pick up that. And as of right now, as I mentioned it, due to the pandemic and all of that, there is a Medicare waiver where the need to have to use the benefits of Medicare are higher. And Medicare waiver has been extended until April 23, meaning you do not have to have the skill need as long as you need help being placed in a nursing home due to weakness and or just because you need to keep yourself isolated. There are specific waivers right now that allow you to come and use your Medicare benefits while you are in a skilled nursing home setting. Just for clarification, that Medicare waiver just applies specifically to the skilled nurse facilities. If you qualify for Social Security, most likely you will be qualifying for Part A. Part B is also referred to medical insurance. I have a next slide that will actually give more details of what is covered under Part A, Part B, and all the parts that are under Medicare. Medicare Advantage. I like to talk a little bit about what's Medicare Advantage. Medicare Advantage is when a person allows a commercial insurance to manage their Medicare benefits. When this happens, you may hear this as option C, Medicare Advantage, Kaiser Medicare, Blue Cross Blue Shield Medicare, etc. And that is somehow to reuse the whole money that you have allocated under your bucket of Medicare. The advantage of having a Medicare Advantage, the redundancy there, right, is that you could waive the cost for some of the co-insurance, co-payments. However, when it's being managed by a commercial insurance, the plan is completely different. Most of the time, they will ensure that the services that are being covered under Medicare are also provided under the same Medicare Advantage plan. However, the benefits change. For example, I was saying in a traditional Medicare A and B, to come at a skilled nurse facility, an episode of Medicare will be 100 days. And as long as you have the skill need, you could use up to 100 days. In the case when there is a Medicare Advantage plan, it is different. The 100 days may not apply. There may be 60 instead of 100. And each plan is completely different based on what the insurance has offered to you and the plans that you have with them. Myth number 3, are we automatically enrolling Medicare? Not true. In the cases where there is disability or end-stage renal disease, you actually have to start the process from the scratch, usually with the help of the hospital or with social workers, the Department of Health, Social Security. They all can assist with that process. In the case of people that are turned 65-year-old, the best advice is start with the Social Security. Once that they apply at the Social Security, and that can be done 6 months, 3 months before they turn 65, then they automatically, if you're already receiving Social Security benefits, then automatically you will be enrolled in Medicare Part A and B. And you will be getting it on your mail. Like I said, that is if you already enrolled in Social Security. Medicare will only cover my hospital expenses, as that is also another kind of misconception that will cover only the hospital. Not true. As I mentioned, at Medicare A, which is a lot of people call it as a hospital insurance, and I think that that's where this misconception comes. Medicare cover Part A specifically covered for hospital stay, skilled nursing facility, hospice, and also home health when it's in the community. Now, important to mention that you could not have alternated all of this at the same time, right? You could not be driving home health if you are at the hospital and vice versa. Medicare Part B, a lot of people know it's a medical insurance because this is the one that they use to go to see the primary care physician, outpatient rehab, medical supplies when you're being discharged from a nursing home or are at home with a home health agency, ambulance and preventive services. I also want to share that Part B also covered for some high cost cancer medications, and that was passed later on, but very, very important and helpful for many people that are currently needing those really priced meds. Another important thing to mention here is that all of these benefits, these services like the medical insurance under Medicare A, B, and D, they do have co-insurance and co-payments that it's case by case, and what the service that you're receiving at that time. Medicare Part D is the prescription drug that you obviously not able to use while you're at the hospital because everything is inclusive. Same when you are in a skilled nursing home under Part A, everything is inclusive. The nursing home will provide you with the care that you need, room and board, social services, of course, food, medication, and everything is a bundle under Part A. Now, when you go into the community, then that Part D is when it comes in handy for you. Or if you're staying in the nursing home under long-term care, Part D will also be useful and help to cover for the cost of the prescription. So you don't have to eat that cost. Will Medicare pay for long-term care? No. Interesting, when we work with social workers and case managers at the hospital, and they say, well, the patient's coming to you under Medicare and this long-term care. So just to clarify, the patient may need skilled nursing care when he's being discharged initially from the hospital, or when he's in the community in fall, or just in need of some ADLs at the beginning. Although he may have 100 days within the cover of Medicare, the skill need may be only for the first 2-3 weeks. And after that, the patient may continue needing to stay at the skilled facility, at the nursing home under long-term care. But at that time, a pay-as-you-sort change will happen. And this is when long-term care Medicaid will take place. So although the patient may come initially at the facility, we know it's going to be a long-term care patient. We first will skill the patient and then go long-term care. Now, there will be other situations where the patient is coming straight from the hospital or the community, but there is not really a skill need or participation in rehab or something that is considered short-term and then recovery. And in those cases, the patient has to come straight under long-term care Medicaid. And also, I like to mention here that there is other things that Medicare A will cover, like when the patient is ready to go home, you know, like we talk about the home health and some DMEs, but in this case, they will not cover the long-term care, but there will be some follow-up if they go home and they need those services there. Let's move on. Now, exciting, let's talk about Medicaid. Myths of Medicaid. Medicaid is available for anyone to cover medical expenses. No, just as a Medicare, there has to be a clinical requirements that has to be met, as well financial. The program is often the last resort for those without access to any other health benefits or that they need assistance with medical expenses. And one of the things that comes to mind when I say this is like, if I am currently working, I could be eligible for Medicaid if my income it's not enough to, or my company do not provide a health insurance. But at this time, it will not be free. I will go through the Maryland Health Link and I will apply for Medicaid that in somehow will be the insurance that will subsidize the plan that I will get into there. So it's not the first one that I will go through because that's what the state has established in terms of requirements. Medicaid also has different programs, as I mentioned it. We have what is called the community Medicaid, the long-term care Medicaid, as well, all the beautiful programs that are under the waiver. So we will talk further about those too later on. I have to meet number 2 under Medicaid. I have to dispose all my resources to get Medicaid. That is not true either. As I mentioned, the Medicare has different programs. The requirements to apply for community Medicaid in terms of financial and clinically, how do you health is currently, are completely different than the requirements under long-term care and the waiver program. A lot of people ask questions in terms of what it should be my income in order to qualify. For community Medicaid, we base this information as 1,489 based on the poverty line of the state. For long-term care Medicaid, it's case by case, and it could be, you know, we ask for the bank accounts, etc. This is part of the state of Maryland requirements, and they do ask that you have no more than 2,500 in the bank, and that is different of what you actually receiving on your monthly basis, whether for Social Security or disability, or there is a pension, or you may be receiving part of the VA. So all of that is taken consideration, and that usually business office specialist or a social worker will be able to help you understand the whole process in terms of financial requirements, which, as I mentioned, it is different. It's meeting the clinical requirements. Another good example that I can use here: individuals in married couples are permitted to own property and still qualify for Medicaid. The Office of Long-Term Care Medicaid has as what they call as SRT team, a special review team, and a case worker that is usually assigned to the case, and they review case by case to see if the person of the married couple will actually meet the requirements. In most of the cases, if one of the married couple needs to come to the nursing home, it will be sensitive to ask that they sell the house when the wife or the husband is still need to live in that house, right? So that's why it exists a special review team for Medicare. Myth number 3, Medicaid benefits do not work. That is not true. And I had this, I think that this is an important myth, because a lot of people will tell me, well, but it doesn't cover this, it will not cover that. Currently, 80% of non-early adult Medicaid are actually beneficiaries of Medicare. And those are actually working families. People that, as I mentioned, work for small companies or just work part-time and they do not qualify to get health insurance through their employer, they are able to get it through Medicaid. And this is the Maryland head link that I mentioned at the beginning. Also, the people that, and most of the time, are not working and they're just get admitted at the hospital, they also have the opportunity to apply for emergency Medicaid while they are at the hospital, and get a ton of help with those hospital bills. In addition of the tremendous population that we have of elderly on the skilled nursing facility and long-term care, that they benefit from Medicaid, that they will not be able to pay private pay or staying with those facilities. And in addition, more important, all, like I said, the wonderful programs that are under the waiver with the Medicaid. So it's definitely something to consider. And I know that this myth is there because a lot of people say, but I have to turn in all my income or I will not be able to do this. I always advise, just get your questions answered, look for information in the right places, and definitely Medicaid is that, program that works and helps a lot of people. Myth number 4 is it is better to be uninsured than be on Medicaid. Again, this is just as an addition of the previous questions. Medicaid coverage has a positive outcome on the social impact on the beneficiaries. Not only with the coverage, but there is plenty of preventive clinical that the patients can go to either to the physician, either just to follow-up appointments. Some specific Medicaid, depends state by state, even help to cover for transportation. And this is the case actually for in the District of Columbia. In Maryland, they would also cover the transportation if the patient is being transferred for the nursing home to the hospital or vice versa. In some cases, people that are at home and needs to be transported to the dialysis center, Medicaid would also help with this. I mean, just think about it. The convenience of coming to be picked up at your home and, taking into the dialysis and then pick you back 3 times a week. This is definitely something that I tell people they have to just get the facts and get the right answers. Medicaid also have an expansion that has increased the access to mental health, in addition treatment services for some of the recovery centers that are through the state of Maryland. And definitely these, playing an integral part in addressing the opioid crisis in multiple states. I know in some areas on the Eastern Shore, this has had a tremendous impact. The fact that now they can use Medicaid to cover for addiction centers and recovery centers, just even the access to have a hotline under Medicaid for those that are need access to mental health. We have seen the numbers show an increase during 2020 due to the pandemic. What happens if I don't have any insurance cover? Where to obtain information? Where do I turn around? This is, like I say, also very important. There are specific online access that we can go and read. There is phone numbers, the Social Security, the Department of Health. We also have agencies, the agency office, and in the community there is social services office that are always available. They have someone that is going to be able to answer the questions, even if they just have questions that how much do I have to make, what is my income, my minimal income, or what has to be my clinical conditions. Now there is even social workers in the community that will come to your home and assess and to help you fill out what we call a 2871, so that we can come out with a level of care, which means to see how much of needs you have, and would it be safe for you to stay at home, or is it better to come to the nursing home? Would it be actually qualifying to one of the waiver programs? And this applies for the ones that need assistance with paying home rent, assisting with getting someone to come home and help with the ADLs on the day-to-day, as well other great programs that has to do with primary care physicians, etc. So I always say, for Medicare, for Medicaid, there's also the Agency of Aging office that is has a lot of information with where to go within your community. These are just some interesting facts. According to ARP, currently 40 million adults in the USA and the United States need long-term care support and services. Approximately 700,000 of those are long-stay residents in nursing home. So if you see, that's a big gap that are already in the nursing home versus the one that are at home and that are needing long-term care needs. Roughly 300,000 engaged short-term post-acute care, rehabilitation, and skilled nursing homes. A lot of the population that come into the skilled nurse facility, and statistically state that is about 70% of the people that come into the nursing home to participate on rehab, they ended up staying as a long-term care residents at the nursing home. A lot of the nursing home have areas that are specifically for those that are coming just for rehab, and those that this is going to be their new home and turn into long-term care. We have over 500 adults that are living in assisted livings, and the bulk of those 40 million people, approximately 85% or 12 million, live in their own, receiving in-home care, which is also another great way for them to being careful. I do believe that a lot of our elderly, and as a Latina, I would say they want to stay home. They want to continue with the surroundings that I have, that they are being and that they feel comfortable with, and that in the day-to-day interacting with the family. I know personally, coming into the facilities and seeing my residents without, missing the loved ones, it's a really trouble. So I can relate to that, staying home, right? And that pretty much concludes my presentation. I do want to go over now the questions.
Great. And we've got some questions that have come in. Would you like to me to get started with
Yes,
those,
please.
Maria?
I get started with yours.
Okay, so let's see. First is Evans Roslin says, what was the date the waiver has been extended to? April what?
April 23rd for Medicare.
Okay.
And
And then,
That is for the
Okay.
Medicare waiver, correct?
I think that's what
Yeah.
he was referencing. And then also, is it better to have straight Medicare or an Advantage plan? Do you have a choice when you apply?
So initially, you should get just a straight Medicare. So in my opinion, traditional Medicare is the best option. But I also think that you have to waive of how much contribution you have given to the Medicare office, or like what I call on your bucket through your whole work career. Because based on that is how you can take more advantage of a Medicare Advantage plan. In some cases, remember, a commercial insurance is still a business, so they will and somehow take a cut of, to cover their, I would say, process fees, etc. So having Medicare traditional may incur you paying some co-insurance co-payment, but you also will have the opportunity to walk into any nursing home, any physician, and this is a federal program. So any new clinic, has to be part of Medicare if they wanted to provide the services, versus if you go with a Medicare Advantage, and let's just say you get Humana Medicare Advantage. So if that physician of that clinic or nursing home is not part of the network of Humana, you may end up paying out of network cost. So, or you may not be, depends on the plan that you get, if it's an HMO versus a PPO, you may not be able to go into that specific facility that may be around the corner from where you live because of the limitation of being in network. But I will say it is case by case.
Okay, great. Let's see. Leslie Kessler asks, if someone does not plan to start Social Security at age 65, how is Medicare obtained?
So it's actually at a package deal. You have to go through Social Security in order to get Medicare. And again, Medicare is actually entitled for those that are 65 and retire. So if you are 65 and you continue working, Medicare will open a case on your file and notice that you continue working. So your employer should provide insurance, or you should pursue it, so that way you can continue having coverage, because you will not be able to use your Medicare benefits. So if you're not ready to retire and apply for Social Security, you won't be able to use the Medicare benefits just yet.
Okay. And then let's see, Yi Nabi says, could you send the PowerPoint presentation via email? I've got a copy of that. I'll give it to the Care Patrol team and they can send it out to everybody. Is that okay with you? Okay, great. And then let's see, Leslie Kessler says, when someone needs a long-term care bed but has not spent down, how can they be approved for long-term care Medicaid? That's a good question.
It is a great question. Medicaid allows you to spend down on a specific things. For example, funeral arrangements. You could also spend down on dental. There are a list of things that you could spend down. I personally always recommend to look into the options before you start paying privately to a nursing home and to just qualify for Medicaid. It is important to also mention that some of the assets that someone owns, it may comes to play in terms of qualifications for Medicaid. So if you have 401k, if you have life insurance, all of those things will need to cash out, before you even qualify. So the best way sometimes, if you have a lot of assets, is just to get an elderly attorney that can help you, walk you through the process. because the state of Maryland in some cases will ask for bank statements 5 years back, so they can see and track where the money has been spent. Otherwise, you may be penalized and not
Okay.
qualify for Medicaid.
Let's see. And Stacy Kerr says, if a client has Medicare services and has been covered at 80% for a recent SAR admission, can he apply for Medicaid to cover the balance? And what is an SAR admission? Do you know?
Sure, SAR, short-term rehab.
Oh, okay, short-term rehab. Okay, great.
So
Okay.
here, if someone is coming into the facility to a skilled nursing home with Medicare as a primary, and they have already community Medicaid could pick up the copayments of the 20% that Medicare doesn't pay.
Okay,
If
yes, and they do mention that the client does qualify for Medicaid.
Yes, and if they already have long-term care in place, but went back home and now returned back and still with the first before the pre-certification, then they will also pick up the bill. So yes.
Okay, and this is a follow-up, but I think phrased a little bit differently, is Vicki Jones says, I thought Medicare only covers 80% of any bill. That's why a secondary insurance was needed to pick up the difference of the outstanding bill.
So Medicare gives you up to 100 days per episode. Only the first 20 are fully covered, and the day 21 to 100, that's 80 days, Medicare's cover just 80%. So that's why you need either a commercial insurance or Medicaid to pick up that 20% of co-insurance.
Okay.
Usually, if you are in a nursing home setting, the nursing home will give you the options. Will tell you, okay, this is per day, the 20%. This is what, the equivalent in money, which is $183 right now. And, times 30, or depends on how the facility bills you. But if you have community Medicaid, they can cover that 20%. As well, if you have long-term care, or you have what they call a supplementary insurance that covers whatever Medicare doesn't.
Okay. Sharon Daly says, what is the monthly income amount allowed to be eligible for community Medicaid? I find that most people on Medicare are not eligible for community Medicaid.
Yes, if you are in a long-term care setting, you will not be able, if you are in a nursing home, you will not be able to apply for community. Now, if you are in the community, they go based on the poverty line, which is currently for the state of Maryland, 1,468. Now, there is other things that play in place for community Medicaid that is not just the income. There is also, are you working or you're not working? Because if you are working, most likely they will want you to go through the Maryland Link Health and to get at what we call MCO, or commercial insurance managing your Medicaid, because Medicaid subsidizes whatever part you are not able to cover.
Okay. Let's see. Yi Nabi says, is the same Department of Health and Mental Hygiene where I can apply for acceptance of Medicaid waiver residents at my assisted living facility. So this is an assisted living facility operator asking where does she go to a Department of Health and Mental Services to apply for acceptance of Medicaid waiver residents.
Yes, they can help you, and also the Agency of for Elderly, some social services office too. They usually, and it's my understanding that the Department of Health has a specific unit, and they will have caseworkers that work based on zip codes so that they can assist assisted livings and people in the community specifically that need program help with the waivers.
Great. Let's see. A question from someone that says, what is a Medicaid trust? Who should have one? And should this be part of your estate planning?
It should be part of the estate planning. I believe that this is similar to, like, do I want to have a 401k? Yes, right? Do I want to have a life insurance? Just anything that you can actually do. So a Medicare trust plan is just basically where you contribute higher amount of money to your Medicare account. Very, very smart thing to do. As I was mentioning before, you know, I visualize my Medicare bucket here. And if I'm a lawyer and I have a good salary through my working life, my percentage of contribution to Medicare, it may be higher than me in my other life where I, you know, get at average salary a year that is lower than 35,000 a year. So remember, it's a percentage that's being deducted on your paycheck based on the total that you receive. So if I'm a person here with 35,000 as a salary per year versus a lawyer that may make, I don't know how much a lawyer makes, let's say 250,000. So their contribution will be different. So when the time comes for retirement, the amount of money or the trust that is on that bucket under your name is higher. So that allows you to have room for part A, B with other, with faster. So, and then you can even then dispose to use what we were talking about, Medicare Advantage. So you have enough money on your bucket to allocate for AARP, for Blue Cross Blue Shield, or any other commercial insurance to become a Medigap, cover anything that Part 8 doesn't.
Great. Let's see. A follow-up question from Leslie Kessler. She's not ready to retire, but doesn't have employer coverage, healthcare coverage. So you're still working, you're 65, and but your employer doesn't cover you on healthcare. I'm assuming that you can apply for Medicare in that situation.
Yes. So this is where Medicaid comes and will give you through the Maryland Health Link. You will be able to put in your information, share how much is your income, and there is a calculator that will tell you based on your income, you know, and since your employer cannot provide the health insurance, you could pick into these plans, and they will give you the options of the plans, and they will also tell you how much you will have to pay. Now, it will not be just, like I say, 100% free, but it will be way less than just go straight to a Blue Cross Blue Shield and buy a plan, because it is a Medicaid subsidized program.
Great. Boy, here's a really good question. Can a non-citizen green card holder who's 65 plus get Medicare?
Unfortunately, no. Medicare is only for US citizens. Yeah.
Okay. All right. So,
and just to add to that question, green card holders with 5 years or more can apply for long-term care Medicaid.
For Medicaid.
That's the Medicaid. They are only until you are a US citizen, you can apply for Medicare. However, if you are 5 years of having a green card or more, you will qualify for Medicaid, which is the state.
Okay. All right. So let's see here. Okay, this is a longer question. These people know, we know people who were on Medicare for cancer therapy and treatment. They were under age 65. When they had their 65th birthday, they were taken off of Medicare and Medicaid and placed on a Medicare Advantage program. There were many confusing details, but their Medicaid ended and they had to reapply and required to give a lot of additional financial information. They missed 6 or more months of cancer treatments because of the confusion. Are you familiar with this, and can you explain the additional requirements once you turn 65?
Yeah, so that means he was getting Medicare due to disability because he was not 65, right? And just to hearing, I'm so sad to hear the mistreatment, because sometimes commercial insurance will sign up people without giving consent. I know there's still a lawsuit going on with big health insurance because it was automatically enrolling people in Medicare Advantage plans without their choosing. So if you guys remember at the beginning, I mentioned it, that when you have a Medicare Advantage instead of your Medicaid, traditional Medicare, now you are playing with the rules of the insurance. So with Medicare, traditional Medicare, you get an episode of 100 days every 60 days that you have not used those benefits. So you exhausted your 100 days, then you were off Medicare of using those benefits for 60 days, then you will get, and then now you have the need again, you may get an episode again. And that's for nursing home. If you are on a straight Medicare, Part B, and will continue paying for the treatment. Unfortunately, if you did not sign up for a Medicare Advantage and somehow you ended up having that, now it's up to them to decide if they want it for how long, and if how many episodes of treatment they will give you, and for how long they will cover. I have done verification of benefits for some people that sign up for a specific Medicare Advantage plan, and all that they get, it is 60 days per calendar year under the new plan of Medicare Advantage. Because unfortunately, the funds trust that they had on the Medicare are not enough to provide, like another plan that instead of having 100 days per episode of Medicare coverage, now you will have 180. Now, when you disenroll probably from that Medicare Advantage, you probably have completely disenrolled of Medicare, and that's what that you have to reapply. Now, there is a process of appeal in special cases, for people that are going into treatment, that you should try to see if that can be expedited within the Medicare office. Because it's so unfair that insurance sign you up. As I mentioned I know that there is a still going on lawsuit because this insurance company was placing calls to our grandmas and grandpas and will just say, is this Miss Jones? She will say yes, and that yes was already what they were using to enroll them into a Medicare Advantage plan.
Yeah.
So terrible. So
Okay.
I always recommend them to, be aware what type of plan you have, read any paper that comes through your mail, and just make sure you're not signing in without having all the facts.
Okay, great. And we're getting close to the top of the hour, so I'm going to try to get through this last group of questions. Let's see, Rosalind Evans says, for persons looking for long-term care that have their name on a deed with other family members, like their siblings, is that considered an asset that can go against eligibility for long-term care or Medicaid, or Medicare, Medicaid?
So I couldn't understand that they have the name
So like
on a deed.
they would be like on the deed to a house or another asset.
Oh yeah. Unfortunately, it will count. Yes, because that means he's part owner of that house.
I think so. If the name would be on the deed, and I think as you had advised earlier, these are some of the reasons to consult with an elder law attorney.
Yes.
Because there may be some trusts and some other techniques that can enable somebody. Yeah. Okay, let's see. If you have Maryland Medicaid for your secondary insurance and original Medicare for your primary insurance, you do not have a Medicare Advantage program. As a snowbird, if you spend the winter in Florida or Arizona or another warm state, and you keep your Maryland Medicaid coverage for more than emergency insurance while you are in the southern states during a 3 to 6 or longer months during the winter, for 80% and 20% coverage, you will need to get another secondary coverage to pay the 20% while you are away for the winter without having to give up your Maryland Medicaid coverage. Hope this is not too confusing. We have tried so hard to get the answer and some supporting information about answering this question. I don't know if I did a good job reading that to you.
You did. You did.
Okay.
Thank you. Actually, as long as you are a Maryland resident and you do not change officially your address, you know, you can go to the warmer weather in a different state. Now, that is if you're actually not working on that state. Right? Now, remember, Medicaid is an insurance you have to pre-cert every year. Even for the community Medicaid, you have to do it every year. And I'm talking community you're not working, right? Not community that you're getting it through the employee. So there is a lot of things that probably I will ask, but just on an overall, it's like as long your main residence is in Maryland, then you're okay with that. But if you are in a different state and you're working there, you're contributing to the Social Security, I mean, to those that through your taxes to that state. You're not doing it to Maryland. So then as soon as you go to that state and you start working, then you know, you will unfortunately lose your rights to the Medicaid benefits in the state of Maryland. Now,
Okay.
I have to say for Maryland, you know, as soon as you move here in a nursing home, if you are in a nursing home setting, that day you are eligible as or considered as a Maryland resident and can apply for long-term care.
Okay. All right. So let me wrap up on this last one here, and then we'll spin the wheel of names. And they say this is so complicated. How do you file appeals when you're ill and have other illnesses such as cancer? Who can help in these situations?
There's social workers in the community. I always say that, you know, even through the Department of Health, there is, you know, Department the aging. There's a lot of help in the community, and there's organizations too that are either through the hospitals, the nonprofits that can assist and walk you through. So I know it is confusing. I know it is a lot of documentation that the Medicaid requires. And also I know that there is not too many staff currently, or a lot of people working remotely from home on all of these offices like the Department of Health, like agency, aging agency and others. But I always say, you know, to ask, even if that means going online and asking if there's an embussment, if there is the local county Department of Health also is a good resource. So not just this Department of Health of the state. So I hope this helped.
Yeah, and I'll close on somebody who shares. Thank you so much for being brave, courageous, and bold to make the effort to teach and educate and inform us about this confusing and complex insurance topic. We're abundantly grateful and thank you. Yeah, you did a really good job and Leslie Kessler says thank you too, of explaining this, Maria. So how about you wave your hand and we will spin the virtual wheel of names.
My pleasure.
Okay, well here,
Thank
let's
you.
see who's our winner. If I can get over to my, oh, come on. Why am I not getting the wheel of, there it goes. Okay, let's see who our winner is. And if the Care Patrol team wants to turn on their cameras. Okay,
Ooh.
N. Elizabeth. I'm gonna write that down and look up her email. And if a Care Patrol person wants to come on and tell us what Elizabeth won, that would be great. I will stop sharing my screen. And thank you, Maria. And thank you, Care Patrol, for inviting me to be behind your curtain today. This was another great program.
Thank you, Maria.
Thank you guys for having me.
All right. Whoops. Let's see. Jessica, you were saying something?
I just said it was very informative.
Okay, great. All right,
Fantastic.
so I will make sure that Care Patrol gets all the emails, the recording, and we'll follow up with everybody and send them the PowerPoint as well. All right,
Great.
Wonderful. Thank you.
Have a
Thank
good
you.
afternoon.
Thank you.
Everybody take care. Bye-bye.
Bye.
Bye.